I'm Seth Kalichman. I'm a clinical community psychologist and a professor of psychology at the University of Connecticut. I've recently written a book called Denying AIDS, Pseudoscience and Human Tragedy. It's published by Springer Science Book Publishing, and all of the royalties from Denying AIDS are donated to buy antiretroviral, anti-HIV medications in Africa. I wrote the book Denying AIDS because there's a significant problem brewing mostly on the internet, but getting into the mainstream media regarding misinformation and myths that have been propagated for really the past 15 or 20 years around HIV as the cause of AIDS. These myths and sources of misinformation are really coming from a few rogue scientists without any scientific support that drugs and lifestyle and poverty cause AIDS. Despite the fact that there's no scientific basis for this misinformation, people are believing it. There used to be not much of an audience for AIDS, these AIDS denialists and AIDS denialism beliefs, but actually now with the internet, this information is widely available. A study done by the Centers for Disease Control shows that 40% of men surveyed in their study endorse the idea that HIV is not the cause of AIDS. This is remarkable at a time when we thought that the public was generally educated. We have evidence that there are conspiracy theories that fuel a lot of AIDS denialism these beliefs are held by 30 to 40% of the general public as well. We also know that in South Africa, where the government was essentially hijacked by AIDS denialists, where health policies became corrupted by pseudoscience and misinformation, over 350,000 people died senselessly because of AIDS denialism. Other governments in Africa particularly have been hijacked as well. One of the other things that we're concerned about, why is AIDS denialism a big problem now, why are we paying particular attention to it now, is also because the environment, there's a bit of an anti-science and anti-medicine environment in our country where people are believing things, information that isn't backed by science, as much as perhaps scientific information, or even in revolt against scientific information. We see that in the intelligent design, new creationism movement. We see that in faulty information about what causes autism. We see that in a lot of medical hysteria that happens in our country. So AIDS denialism is kind of a part of that bigger picture. The other thing that's concerning us is that actually these ideas have been picked up by the mainstream media. And so now there is more visibility for these really off-the-wall, baseless ideas. So what Denying AIDS is all about is trying to expose what the AIDS denialist movement is all about, try to educate the public about AIDS denialism and the wacky ideas behind it, and to sort of see it for what it is, and to see the propagators of AIDS denialism for who and what they are.